Okay. So today we are going to be doing physical therapy on this eagle. We are also going to be cleaning around the IM pins where he fractured his humerus. So the first thing we're going to do is we're just going to cut some of his bandage off so we can actually look and see what the pins look like. We're going to take off all the bandaging and we're going to clean around it and then put everything back together. And before we put the wing wrap back on, we are going to do physical therapy. So I'm just going to take the bandage off first. And we have a secondary bandage here as well that we're going to take off.
Give him just a smidge more.
Okay. So where we have pins is actually on this side over here. So you can see this here is actually our external fixator, and it's actually inside of the bone. And all this gauze here is what we're going to be taking off. We're going to be looking at each pin site, and we're going to be cleaning it and then redressing it. Okay, so now what we're going to be doing is we're going to be doing physical therapy. So how we do this is you want to have one hand on the elbow, which is where my right hand is. Then you have your other hand up towards the wrist, which is where my left hand is. Now the first couple are typically really difficult because the wing hasn't been stretched and hasn't been used. It's up against their body. So you want to stretch out the wrist, so you're pushing out and then up with the elbow. And we're looking for extension of this wing. And we hold it for 10 seconds, and we're going to do this 10 different times. So then we bring the wing back up to the body just to give it a rest just for a few seconds, and then we go at it again. So again, we are pushing up on the elbow and we're stretching out with the wrist, and we're holding it for 10 seconds. And the more times we do it, the better extension we have and the easier it is to actually stretch out the wing. So this is very similar to when people have surgery and they get physical therapy afterwards. It's the same exact thing. So again, what we're looking for is we want this wing to be as straight as possible, and this bird has pretty good extension of this wing since we've started physical therapy. So we are doing this physical therapy under anesthesia. It has been done, physical therapy has been done while the bird is awake, but eagles are very large, cumbersome, and it can be more difficult to do it while they are awake. Also painful, so if they're under anesthesia, then they're not feeling any of that pain, they're not remembering what's going on. So it's much easier for the bird, easier for us, and less stressful. So that was our last one. Now what we're going to do is we're just going to put a wing to body wrap back on, and then we're going to make sure that this wing is up against the body, and we're going to wrap it to the body so it stays put, and then he'll get physical therapy again on Thursday.